Talk a little about errors, adverse events, and bad outcomes, how good processes and situational awareness can improve quality. Medical misadventures happen because of the following reasons, and this is based on error analysis in human literature. There are entire journals in human medicine devoted to quality and quality assurance. It's a very strong area of active study. Obviously, medical misadventures are a huge, costly, tragic condition or circumstance, and so there's a lot of effort on the human side to try to mitigate those and prevent those. We look at systems factors, breakdown in delivery function, productivity pressures. Who's under pressure for productivity at their shelter? Discontinuous care or handoffs, that is, patient care starts in one section or one function and then transfers to another function. And that can be from station to station, that can be from category to category or status to status, so it moves from adoption to some other part of the shelter. There's an opportunity for loss of information or misinformation at each one of those handoffs. So handoffs are a weak link. Weakly standardized processes or policies, or lack of processes and policies, poor communication systems, and then lack of patient data. You just didn't know that the patient had this or that. Sometimes that's because an owner doesn't tell you. Sometimes it's because it wasn't asked. Sometimes it's because it was lost. You had it and then you lost it. It got separated from the patient. Those are all systems. Everything in blue is a systems or a process problem. That is, with better processes, with better systems, with better protocols, you can mitigate or avoid errors in that category. On the bottom in black are individual operator errors that can happen. Failed situational awareness, tunnel vision. You just didn't know it was happening. You were so focused on the abdomen, you didn't notice your patient stopped breathing. Those kinds of errors. Following faulty rules of thumb. That is, if it comes in looking like this, I do this. Well, sometimes it comes in looking like that for a different reason than the treatment you're used to using. So sometimes we fall to rules of thumb, and sometimes rules of thumb don't work for us. Biases, you may be inclined to treat things a certain way because it's worked for you, but it may not work in every case. Mental states or affect, if you're in a terrible mood, if you're incredibly distracted, if you're angry, the quality of your work, the quality of your thinking is degraded. So that's an individual type of error that can occur. And then technical factors, surgical accidents, surgical misadventures. Those things can happen, they do happen, but they probably happen a lot less than these other categories when it comes to bad outcome contribution. Situational awareness. How many of you have heard of this term? Situational awareness. Situational awareness is the ability to know in a complex environment to be able to have a high-level view of what's happening overall. It's what fighter pilots are tested for, to fly very complicated equipment with a lot of distracting data streams coming at them. They've got a lot of information coming at them. They're in a very expensive, technologically advanced aircraft. They're 23 years old. They're flying a $35 million airplane. They screen and test for very high levels of situational awareness so they can keep track of all the stuff that's happening outside the plane and inside the cockpit. And there are various levels that have been described. Again, this is a field of research for a variety of reasons, but with respect to surgery, it's because situational awareness can prevent or can lead to errors. That is, lack of situational awareness.